Well, worries over the UK strain, and at this time when there are worries about its spread, as you can see in England and in other countries, India has resumed flights from the UK. An Air India flight from UK landed in Delhi with 246 passengers on board amid these concerns about the mutant, fast-spreading strain of COVID that has emerged in Britain. Another flight is going to land in Mumbai as well today, and this will be reviewed on the 23rd, is what the Indian government has said. Now, all passengers arriving from UK will have to undergo mandatory RT-PCR tests as well in the UK as well as in India. They'll be in home isolation if they test negative for the test for coronavirus. In Mumbai, though, there is a mandatory isolation, and flights from India to UK, in fact, restarted on Wednesday, even as the number of people who've tested positive for the new UK variant in the country has currently climbed to 82. So 82 people have been detected with the new UK variant of coronavirus. Well, to talk more about this, we're now joined by Dr. Arvind Kumar, Chairman, Institute of Chest Surgery, Medanta Hospital. Thank you, sir, so much for joining us. First and foremost, sir, if you could tell us, are you concerned about, the government allowing flights from UK to, come and passengers to return from the UK? They're saying they're going to test them, and but we do know that even so, sometimes, even if you test, the virus can show up after a few days.
First of all, thank you very much for having me on the show. Thank you. And the concern actually is very much there. And there are three reasons for this concern. One is that these people are having their RT-PCR test. As we all know, RT-PCR is about 70-75% sensitive, which means that if you have this testing done in 100 people who are truly positive, the RT-PCR is likely to give you a positivity in about 75%. 20-25%, and this figure varies from lab to lab, but around 25% may actually be true negative or rather false negative, because they are positive but they are reported negative. Now these people are actually carrying the coronavirus but will test negative and will be allowed to go out. So this is one segment where this problem will occur. The second thing is that, of course, it's not a reflection on the security system, but time and again we have heard people land and somehow bypass the system and disappear. And we already know that out of the flights which landed in the first few days after this crisis became evident, there were about 10% of those people who are still untraceable. Their mobiles are switched off, and these people are a serious threat to the society, and they may just lead to explosion of this dangerous strain in the areas where
absolutely,
they go.
Doctor, and at a time when the cases are coming down in the country, also there seems to be a lack of transparency on the government front. So how's the public expected to trust these protocols? For example, earlier the government had said that 33,000 passengers had arrived from the UK since mid-November and that they would be traced and tested, but so far we've not heard anything about it.
So as far as these precautions, in our country, sadly, many times there is a difference between what is proposed to be done and what actually gets done on the ground in a real life situation. The whole flight arrives, there are about 300 odd people who alight. Some of them will be VIPs, some of them will be connected people, they'll be making calls, or I need to get out fast, and holding them there for the period. There are practical issues where some of the people may actually bypass the best made setup there and be able to exit carrying coronavirus. We are in a very unique and advantageous situation where, as opposed to the US and Europe where the numbers are rising, we have numbers coming down to really manageable limits. In the hospital now, I am happy to report that ICU beds are now lying vacant. It's a happy situation to see those corona beds lying vacant and patients not being there. Against this background, allowing this strain could lead to some kind of a resurgence, and if this new strain was to lead to a resurgence, I think it will be a far more dangerous situation, which can be really avoided by very strong precautions today, even if they cause inconvenience to few people.
Absolutely. Thank you so much, Dr. Arvind Kumar, for speaking to us on the show today.